We start today with more troubling news on the COVID front here in Ohio. We told you yesterday that the number of new cases was our highest single-day total in nearly 3 months. Well, today's number is even worse. Ohio reporting 9,131 new cases today, and that is our biggest one-day total since January 8th, almost 11 months ago. Our hospitalizations, also troubling. They continue to surge in Ohio. In fact, Ohio hospitals admitted 366 new patients, according to the last 24-hour report. Over the last 4 days, 1,500 Ohioans have been hospitalized in their fight against COVID-19. Those are startling numbers.
Absolutely. And meanwhile, another case of the Omicron variant has been found, this time in Minnesota. The patient traveled to NYC the weekend before Thanksgiving for a conference. And Jay, we're also just hearing about that third case now in Colorado. Absolutely.
That brings the total of cases to 3. Obviously, that number will continue to rise. This as the U.S. announces new plans to fight COVID. Sarah Schuchman has been closely following all of today's developments.
It's not just Omicron, but the Delta variant that's still a big concern as we head into our third winter of the pandemic. President Biden announced his plan for the season.
It doesn't include shutdowns or lockdowns, but widespread vaccinations and boosters and testing and a lot more.
The president is stressing it's time for a booster for all adults and working with pharmacies and clinics to expand availability for more appointments and walk-ins with a focus on seniors and families. All international travelers must now be tested within 24 hours of their departure instead of 72. He's also expanding free at-home testing, making rapid tests fully covered by insurance and easier to find in the community. Summit County has already been doing that, handing out more than 30,000 rapid tests through its office, drive-thrus, libraries, and community centers, so people have them on hand at home.
So you don't wait to get a test, and you don't wait 2 or 3 days to see if your symptoms get worse. Because they're free. And if you need to use 3 or 4 of them, we're happy you've used 3 or 4 of them. And so it's been very successful.
Ohio is seeing a concerning increase in cases and hospitalizations, particularly in our part of the state.
But yes, we are feeling it here in Cleveland. We are feeling that wash, and it is affecting care. I think if you look at emergency room wait times, you probably have people that are abandoning care, and so we're seeing that critical point.
Our hospital systems and the state's labs are sequencing positive PCR tests looking for the new variant.
Could it be here and we've not yet detected it? Of course, that's possible. That what we're seeing right now, today in the state, is being driven by the Delta variant.
What you can do is get vaccinated. If you've waited, today, it's perfect time. And if it's been 6 months or 2 months after a J&J shot, get a booster. Doing so now could boost your antibodies and perhaps even prevent a breakthrough case during the holidays, guys.
Got my booster last night, so I'm good to go.
How you feeling?
Nice. Sluggish today. And I had nothing at all after the first 2. But today, just not there. It's, the energy level is way down.
So worth it, though.
Yes, absolutely, and I strongly encourage it. Sarah, if you would, give us some sort of an idea now as to where we are here, particularly the last couple days, compared to our worst point in Ohio in terms of daily cases.
Well, as you said right off the top, Jay, I mean, these numbers are those we haven't seen since last winter or earlier during this fall spike, just in terms of a daily count. Hospitalizations, too, are on the rise. But there are a lot of things that put us in a much better position than we were last winter. We didn't have widespread vaccination. It wasn't available to everyone at this point last December. We also didn't have the treatments that we have now. Not only the monoclonal antibodies being more available, but also some of the new pills that we've just been talking about in the last few days. They're probably soon to come to market. So there are more treatments available. There are more vaccines available. But they do say, it's not just hospital beds, but staff that they're having a hard time with this time around. They don't have the bench strength that they might have had last winter to deal with all of this. And they're seeing that more here in Northeast Ohio than other parts of the state at the moment.
Wow. Okay. Great info, Sarah. Thank you very much.
Sure.